Nairobi County Governor Johnson Sakaja today came face to face with the sorry state of the Mama Lucy Hospital, where expectant mothers are either sharing beds or sleeping on the floor.
Well, the governor was shocked at the neglect at the hospital, where he found no doctors during his impromptu tour. Ayub Abdikadir with the report.
Governor Sakaja was in the company of his deputy Njoroge Musheri and a few other officials when he decided to make an impromptu visit at the Mama Lucy Kibaki Hospital. It is one of the health facilities that is manned by the Nairobi Metropolitan Services NMS. One would, however, imagine that services would be top-notch, but it's not what Governor Sakaja found out. At the entrance of the facility, the governor was informed that most medical personnel were not on duty. This mother had just given birth, but because of the poor bed capacity, she was made to sit here and waiting on the hospital benches. For how long until a bed is available? No one knew. Immediately, Sakaja intervened, instructing few nurses on duty to attend to her. The governor said his administration will take the blame for the sorry state of the healthcare facility.
So we just want to apologize. I know there was a story that had been highlighted about Robert who lost his wife and has the two babies there at Kenyatta. I've spoken to Robert and I'll be going to say pole on behalf of the county and to give support to them. But all those actions can never return somebody who has died. We must do our best to protect life and to give the people of Nairobi the service that they deserve.
Inside one of the maternity wards, congestion. Mothers sharing beds with other mothers and their children. The governor vowing to increase bed capacity of facilities across the city to decongest hospitals.
We're out of capacity here. There's need for expansion and need for our other facilities to be working. If we fully, equip and revive the one in Kariobangi, we'll reduce the pressure here. I want to urge my MCAs, because I've come with a number of them, to help us to keep coming and seeing.
While visiting one of the drug stores in the healthcare facility, the governor was saddened by the fact that all entries for stock are done manually. The lack of medication here quite evident, but things will have to change soon, he says.
Somebody has been told to get some dawa, and the dawa is not here. They're told to go get it elsewhere. Yet it's medicine that is used frequently, and I have those examples. So let me not say any action that's being taken now. We like being objective and, get to the root cause.
And today was a lucky day for patients who had been held hostage for non-payments of services. The governor ordered their release, promising to pay their bills.
There are those who have been discharged and are not able to go. I have ordered that they all be released from the hospital. That they all go, we'll get the account of how many there are, I will pay for them. Those who have been just taken, because we need to decongest the hospital. We're keeping them in beds. Those who need the beds don't have beds, yet we're keeping them for small amounts of money.
Earlier during the church service at the AIC Church in Embakasi South, Governor Sakaja and his deputy assured the city residents of commitment to service delivery, saying all functions that were transferred to the General Mohammed Badi-led Nairobi Metropolitan Services will be back to the county government.
In the due course of time, those systems will change because it's a process of handover from KRA, handing over from the NMS, and so we'll be able to update, but in the soonest possible time.
He further promised to have an open-door policy for all members of the county assembly to ensure that the needs of their representatives are met by his administration, which he said is a priority.